your kidney may or may not be is blue. It's just from the paint that they inject and the blood supply traveling into the kidney. Try to just gently remove some of the fat back there. This is perirenal fat, protecting the kidney, providing fuel source. Like that, there's a kidney. Okay, and then above and medial to that will be the adrenal gland. You can palpate where it is. It'll feel like a pinto bean, and there will always be a vein right over it, right there. And just keep removing that membrane from over the adrenal gland as well. This is the one that we skipped the other day because it was behind this membrane. Okay, so I'm just clearing out a little bit more fat. Alright, it's going to hold this up. And this structure here, above the probe, is the adrenal gland. This looks like a little bean in the cat. Ours is a little more triangular, but still in the same place above the kidney, also called suprarenal gland. You just slide that up there, and there's your nice ureter. And you're going to do that on the other side as well. Okay. Now, like this. All these little tiny blood vessels, we don't care about those. Okay. So here's your urinary bladder, tube coming from the bottom, urethra. Okay. Urinary bladder, median umbilical ligament, ureter, kidney, adrenal gland. Alright, now for females, they'll come around again to everybody's table that has females and show them the structures, and then you can show your lab partners. Now you can see the testis and the epididymis, this coil along it. Right here, epididymis, testis. Okay. Now you're going to give the testis a little pull to elongate the spermatic cord. Remember, the spermatic cord is a connective tissue sheath that is going to wrap the vas deferens, the blood supply, lymphatics, and nerves going to and from the testis. You can see this is a wrapping, connective tissue wrapping, spermatic cord. And there's the glans penis there, a little bit farther, and there you have the penis. Okay, right there. Alright. Now the vas deferens are going to be white tubes that are coming through the inguinal canal. Now the inguinal canal is going to be at the base of the pelvis in the wall, in the abdominal pelvic wall, and here it is. And you can see that the probe travels all the way down. It's a canal that will lead through the spermatic cord into the testis. And I accidentally cut this side when I did the urethra. Luckily we've got two sides. So here's that inguinal canal on the non-dissected side. You can see how nice that canal is there. Okay. This white tube that's coming from that canal and looping back behind the urinary bladder is the vas deferens, this tube right here. Okay. And there should be one on each side. Alright. And we'll either have a different video or I'll come around to the tables to show you the female structures. Urinary will be the same though. Suprarenal gland or adrenal gland, kidney, ureter, urinary bladder, median umbilical ligament, and then you find the urethra the same way, and it's going to be the tube leaving the bottom of the bladder. Okay.